Thank you so much, Tom, for covering such an important topic. As he said, we encourage everyone with Parkinson's to ensure that they're prepared for an unplanned hospitalization, especially during this coronavirus crisis. Viewers in the United States can request a free kit at parkinson.org/store. And if you're joining us from outside of the United States, we encourage you to print the kit contents from parkinson.org/awareinCare. I will be moderating this panel, leaning on my experience as a 211 crisis hotline counselor, providing short-term confidential crisis counseling information and referrals on 4 different hotlines, along with my time as a community program manager for the Parkinsons Foundation before stepping into this role as Associate Director of Education. I'm joined by Amy Goyer, author of Juggling Life, Work, and Caregiving, and a nationally known writer, speaker, and consultant specializing in caregiving and family issues. Amy serves as AARP's National Family Caregiving expert, columnist, spokesperson, and moderates the AARP Facebook Family Caregivers Discussion Group. Along with Amy, I'm joined by Kara Barton, who is a clinical social worker at the Keck Medical Center of University of Southern California in the Department of Neurology and in private practice. She provides resources and referrals for neurology patients and their families, and psychotherapy for individuals, couples, families, and groups. She's facilitated various support groups for caregivers and people living with various neurological diseases, along with mindfulness and meditation groups, and is a certified trauma-informed yoga instructor. So thank you guys so much for joining me, and we will kick off our panel on resources and care coverage. So let's start with the first question from Sylvia in Florida. How does respite care work? How can care partners access it? Amy, do you want to start us off?
Sure, happy to start out with that. And thanks again for having me here. It's a great pleasure to be a part of this. You know, respite is one of those things that people have kind of different ideas of what that is. Essentially, think of respite as a break. It's someone to help you care for your loved ones. And respite may take place at home, where if you're caring for loved ones at home, you may have someone else come into the home who can help take care of them and spend time with them so that you get a break. Maybe in some cases you can leave and go do something else. Of course, right now that might not be possible. But you can also I had respite to help with my dad, and we were at a point where we kind of needed 2 people to do things with him sometimes. So it was still a break for me because I could do other things in the home and then still be able to be there when, you know, I needed to get him to the bathroom or that sort of thing. So think about in-home respite. Another form of respite is out-of-home respite. Adult day services or adult daycare is another really important form of respite. So for some people, your loved one might be able to go to an adult daycare center, adult day services center, or adult day health center. They might have different names, but they can go every day, 5 days a week. They can go sometimes just 1 or 2 days a week. You might go for part of a day, and it gives you that break. And they're in a congregate setting where there are other people, so they get socialization, activities, usually meals. A wide variety of services might be delivered while they're there at adult day services. It's also a pretty cost-effective way of doing this because you pay usually one flat fee for the whole day rather than paying someone by the hour. There also are respite facilities. So it might be that your loved one might go to an assisted living facility for a short stay or a nursing facility for a short stay. So that's another way to look at it. 2 key resources for you on finding respite care. Actually 3. One is if your loved one is a veteran, be sure to check with your VA healthcare providers to find out if they are eligible for some VA provided respite. We had that for my dad, and that was a really big help. We had about 6 hours every other week. And another thing to do is to contact the elder care locator. And you can go to eldercare.acl.gov and you put in your zip code, and that'll give you your listings in your area. And you can contact the Area Agency on Aging and ask them if they have any information about respite care for your loved one. You can also call the Elder Care Locator, and that number was 1-800-677-1116. And then you can actually talk to a person who can help better point you to services. And the other great resource is the ARCH Respite Network. ARCH is an organization that focuses all on respite, and they have a great tool. It's a respite locator. So you can go to ARCH Respite, ARCHRESPITE.org/respite locator. On their website, put in your zip code and find all kinds of respite programs. You may have to pay for respite. In some cases, it will be paid for, say, through the VA. And there are also volunteer respite programs and local services, state funds, et cetera, that you might be able to tap into. So it's really important to connect with all these resources.
Yeah, absolutely. And the area agencies on aging that you mentioned, I think, is a really key resource to remember. It looks a little different depending on where you are. Some area agencies have more funding available, and some have less. But a lot of times there is at least some free resources available for certain people in your community. So there may be really strict income and even asset requirements to qualify for free respite care through your area agency on aging. Sometimes there may even be a county office on aging that has some sort of respite fund available, but it's always worth looking into. Kara, I'm curious how frequently you hear from the families you work with in clinic that respite is being utilized. Do you feel it's something that could be utilized more?
I absolutely feel like it could be utilized more. I think it's cost prohibitive for most people. We have in Los Angeles County, we have an agency, LA Caregiver Resource Center, and they get funding. There are a couple other agencies that get funding from the county and from the city for respite care, but the money goes really quickly. So I think people in the know do that, and then there's no money left. But I think that I like what Amy was saying about respite can come in many forms, and sometimes that means that whoever can come in and be with your person with Parkinson's so that you as the primary caregiver can get a break. It may be that you walk to McDonald's and get a $1 coffee. It may be that you sit on the stoop. It may be, clearly pre-virus at this point, everything's kind of up in the air with the virus, but the idea that, what does it look like to get a break? I think being creative is one of the keys to, even with COVID, we're going to not talk for 1 hour, we're going to create ways of having healthy space from each other so that we can manage difficult situations. Respite is a big deal. And I think we'll probably talk a little more about for both people in the caring relationship.
And if I could just add one more thought, sometimes respite is a family member or a friend just coming over and spending some time with your loved one and engaging them in conversation so that you can cook dinner or have a break or not be the one who's on 100% of the time. So that's another way of kind of getting some free respite.
Well, and that brings me to another really great question from Amy in California, who asks, how can I get help so I'm not doing everything? I'm having trouble figuring out who I can outsource tasks to. And I think taking a real inventory of the people in your life is the place to start. Looking at friends and family members who are in town first, maybe even neighbors or, church or other religious group community members, to see who might be willing to step up and do something small so that you can get a little bit of time to yourself, even if you're still in the house while they're doing so, can really make a big difference. Do either of you want to add a little bit to that about how to really take inventory of the folks in your life?
I'll go.
Sure, I'm happy to start, and maybe, how do you want to divide this up? Just the first thing that I always suggest is looking at the immediate circle first, and then kind of working your way out, like the layers of an onion. So the immediate circle, you're going to think of family and close friends, and then neighbors, people in the faith community, people who you have connections through because your loved one does go to adult day services and you have connections through that, or other services that you have. And really think about what people are willing to do. And, you know, a lot of us waste a lot of energy getting frustrated about what people aren't doing. And on the caregiving team and in the family, et cetera. And, you know, after a certain point, you start to realize that it's just pointless. You're losing your energy on that. Instead, think about what they will do and take full advantage of that. So it may be, for example, I had a sister who was very ill and lived at a long distance from my parents, and she would have loved to have done more, but couldn't. And so I asked her to call my parents every day. And she did that. Even she'd set her alarm if she felt horrible, and she'd get up out of bed and call my parents and go back to bed. And it meant so much to them. And it was a nice break for me and my other sister when we were caring for my parents. So try to think about that. Some people are better at doing finances. Some people are good at hands-on care or cooking or yard work or whatever. But, you know, try to tap into what people can and will do.
What I like to do is explore with people what their support system looks like. And often there's that identity crisis of, I don't want to need help. I'm the helper. I always helped everybody else. So sometimes it's such a crisis for someone to be able to say, I really need help, whether it's the person receiving the care directly or the caregiver saying, we need something else to keep us going. And it's that old adage of feeling like you can't take time for yourself, like somehow that's selfish. And I like to call it self-preservation. You know, if you're so important to the system and you collapse, then everybody goes under. It's not just you. So you have to sustain yourself. So one of the things I like to do is explore what the needs are, and then talk about how when you are sick, you can't be cured. People feel helpless. But when you say, I need a casserole on Tuesdays while I take the kids to the class, then people can do something really concrete, and they can feel like they're contributing to your life. And they can't cure you, but they can love you and help take care of you. And I think, like Amy said so well, we all have different levels of skill. So it's important to, sometimes what I'll ask somebody to do is write up an email and say, these are some things that I need. And I don't want you to take on anything that you don't feel like you can take on. But, you know, one woman I worked with said, you know, if my in-laws always say they wish they could help, you know, they could order a pizza from across the country and feed my kids one night. Like, that would make my life easier. So I think to think about tiny things, like you could come over one day a week and pull the garbage cans in, or, you know, it can be really tiny things that for a person who is overwhelmed would just be such grace. And so it's an opportunity to offer something to yourself and to other people who actually want to be of assistance, and you can give them that opportunity.
Kara, I want to highlight something you said that maybe didn't jump out at other people, but the idea of asking for help in an email, I think, is worth highlighting. So many times people have trouble getting up the nerve to say, I need help. Saying those words out loud can be really intimidating. So to think that it can be as simple as really sending a text message or an email to say, hey, you know, I'm feeling overwhelmed. I'd love if you could help with X, Y, or Z. Let me know if you can help with these, or if you have any other ideas about how you could help, you know, based on your own availability and what's realistic to you. Let me know what you think. I think that's a really low pressure way to ask for help. So I'm glad you shared that. Let's talk a little bit about keeping your loved one at home. We got quite a few questions about this, and it's a common question that we get. So first we heard from Meg in Florida, who asked, what can I do to arrange for care for my loved one at home as long as possible? And then we got a second related question from Richard in Minnesota. How do you know when it's time to change your home situation to one that's more amenable to PD limitations? So he mentions he has a 3-story house, which is fine now, but he's not sure what to look for, which we'll let him know that they need to make it a little bit more PD friendly. Kara, do you want to jump in on that one?
Sure. One of the things we like to do in our neurology department is really work as a team with the other professionals. So it's not just a doctor or myself, the social worker, or just getting therapy, but occupational therapy, physical therapy. And so sometimes what we'll do is we'll refer to OT, occupational therapy, and we'll have somebody come into your home or look at what your body's doing and see what your body needs are, and then say, okay, so if you're having gait issues, you don't want rugs on the floor. If you're having balance issues, you want to make sure there aren't sharp objects around the chairs you're using the most. How low are the chairs you're using the most? Just a check-in out of your environment. But we often also will have the doctors prescribe an in-home assessment where somebody will come to your house and just look at your house and see, oh, look, if you just did this, or you tweaked this, or you moved that, eventually, would you want to add a bathroom onto this floor, or do you consider moving the bed into the living room? I mean, there's all kinds of things. And then, of course, there's that affordability issue. But really, your job isn't to anticipate. Your job is to know when to ask for an opinion so that you can start forming some ideas about what's possible. Do you want to downsize? When would you need to do that? Is the first floor livable? What would need to change if something needed to be done? And then considering that's not your job to figure out. You get professionals to come do that with you and for you, and then pace yourself so that you're not doing, and some people can't afford to make a lot of changes, but there are places that can help you pay for that, and places that can help you get equipment that you need and make changes. And I found that a lot of people in the care support environments are able to refer to great, reasonably feed contractors and things to get stuff done. I know people sometimes have railings along the hallway and things, and it's really can be done in a nice way.
Well, and the other thing, especially when we think about cost, I think it's helpful to start doing this work long before you need it, knowing that this is coming. It doesn't hurt to start thinking about it before it's a problem. Amy, do you have any other insight you want to share on this topic?
Yeah, I would just add in terms of thinking about the caregiver themselves, and that the fact that you may be giving increased amounts of care to your loved one with PD, and thinking about how you will provide that care. Sometimes making modifications in the home to make it easier for you to provide the care is part of the consideration, and how many flights of stairs you're going to be running up and down every day, even if you move the bathroom downstairs or you move the bedroom down to the first floor. So thinking about it in broader terms, in terms of care that you'll be providing. And also, we think about safety first and provision of care. And, if you're going to have someone coming into the home to help provide care, and you want to keep your loved one in a home setting, then think about that person. Are you going to eventually have a live-in caregiver, or someone who's going to be spending the night? Are you going to need to have an extra bedroom? Thinking about those sort of considerations, but also consider quality of life, because quality of life is really everything, right? And so we think a lot about safety and the healthcare and the provision of care, but quality of life. So that's a real factor. And so, for example, if your loved one loves to garden and see the flowers and wants to be able to see outdoors, and you're considering moving to a senior community, find out, can we still have that opportunity? Can we have a patio? Can we have a balcony? What's important in that sense? If you have animals, and many of us, our animals are our greatest comfort, and that's going to be a companion as the disease progresses. So think about what factors are important in terms of keeping in an animal wherever you decide to live. So just keeping those other things in mind as well, I think, are really important.
I'd like to just add one more thing that often comes up is if you are in a partnership with someone who is the same age as you are, and you're both older, or you have as well, being a caregiver, have your own health issues, there becomes a point where you may not be able to provide the level of care that your partner needs. And it's a really tough decision, and I don't think anybody can tell you when that's going to be. I think there's an authentic time when that happens and you are able to just know that's your tipping point. But you could then become a partner again, a wife, a husband, a lover. You can have someone else do the care, and you can be then the return to an old role that may have disappeared because you got so wrapped up in caregiving. So for some of our older patients, we end up having them placed, and then the partner can come and just have dinner and hang out and watch a program and actually be more of a partner than a caregiver. So everybody's bottom line, right? If I can't have my dog, if I can't drive, if I can't. But we have to think about the things you can do and what matters the most to you. And sometimes safety is so important, but it doesn't mean you have to abandon all other values that you have.
Yeah, I'm glad you brought that up. And that gets me thinking about when people are maybe ready to start bringing care into the home. We got a great question from Krista out in California, asking about how she can help convince her mom with Parkinson's that she's going to need a few hours of help at home daily in order to keep living independently, to preserve that way of life that she is so used to. She mentions, that low blood pressure is a concern, and that she's having trouble getting her compression stockings on by herself and is slowly losing mobility and strength. So all these things that creep up really slowly, where sometimes the care partner can see that the needs are increasing before the person with Parkinson's does. Kara, what do you usually recommend when you hear from a care partner who is noticing that it's time to bring in some help and the person with Parkinson's isn't so sure?
Well, I usually have the conversation with both people in the room, if I can. Depends how antagonistic the dynamic is, but of course, usually it's the caregiver saying, I want my partner to be, or my loved one to be, as independent as possible for as long as possible. So sometimes it's about energy. So if you have limited energy because of fatigue, do you want to spend 3 hours in the morning pulling on your compression socks, or do you want to be in the garden? And sometimes it's a gift to the caregiver. Sometimes it's about, you may not think you need it, but why don't we just try it? And you can do this for my peace of mind, then I'll know that you're using your energy for all the things that you really care about, not these like things that are harder for you to do, but just don't need to take that much energy. And I often frame it as, if you are an independent person and you want to stay that way for as long as possible, then it behooves you to make decisions to delegate stuff early, because if you have a fall, then you could lose everything. So if you have some say in the beginning about what level of care and who the caregiver is, you're going to have more influence and power over your own domain than if you wait till there's a crisis.
Yeah. Amy, anything to add?
Yeah, I think the reason people kind of balk at things is they think it's a slippery slope. I get one bit of care and then it's just all going to go downhill from there. So I always say the exact same thing, Kara, that the goal is to be as independent as possible for as long as possible. And we're all on the same team here. So my goal is for you to be as independent as possible for as long as possible. I would not be suggesting this if I thought it was going to make you more dependent. So to really approach it that way, that we're in this together, we have the same goal, let's work together. This is, sometimes getting a little bit of help helps you be more independent for a longer period of time. And just to really explain that. The other thing that sometimes helps is to have them talk with someone else who's done that, who's taken that leap and gotten a little bit of help and happy they did so, and explain that, yeah, I'm out gardening, as you said, Kara. I think sometimes getting other perspectives is helpful, and that's where support groups can be really helpful as well.
Absolutely. All right, let's shift gears a little. I want to talk about some other types of support services that might be worth considering. We got this really great question from Laura in California asking about palliative care. So she asks, when do I consider support services such as palliative care? What medical care will we lose as a result of palliative care, such as our own doctors? Amy, do you want to touch a little bit on that?
Sure, yeah. Palliative care is often talked about in the same sentence as hospice care. So it's really important, and there are different philosophies about this and different ways people talk about it. Palliative care is really an approach to care, and as is hospice care. The key difference, the easy kind of way to think about it is that palliative care is, an organized system of care. There's a focus on comfort, but you can still be getting treatment and working towards a cure for an issue. And hospice care is really when your doctor thinks that you have 6 months or less to live, and that you are no longer going for treatment or cure. So that treatment or cure factor is kind of the difference between the two. That said, palliative care can be a lot of different things. Different providers offer different services. Sometimes it's just a philosophy of looking at how you're going to care for someone, but many times there are even organizations that provide hospice that also provide palliative care and will offer, it might be a service that you pay for. It might be that you talk to your doctor about palliative care and how that's provided. That could be, when you're living in your home and seeing your regular doctors, or it could be you're in the hospital and you start talking about palliative care. Or hospice care can be done as well. There are hospice care facilities. So try to talk with the doctor and really get an understanding of what your goals are. I mean, that's really what it's all about. What are the goals? What is the prognosis? What are the treatment options that we can have? And, you might still, you get pneumonia, you can still treat for pneumonia. And when you're in hospice care, in some cases, you can do that as well, depending on what your diagnosis is for hospice care. So it really, I think this is a great topic because there's a lot of confusion about what these care provisions are. The National Hospice and Palliative Care Organization has some great information on their website. And really importantly, again, talk to your doctor about it and understand what can be provided. If your loved one's in the VA, is being under VA care and is a veteran, they also have some really good systems. They have home-based primary care, which is what we switched to for my dad. And then we were able to get a really nice team of nurse practitioner, doctor, OT, PT, everything that wrapped around so well. And it's more support in some cases for the family caregiver. So that's something else to think about.
Yeah, Kara, you look like you might have something to add. Yes.
Over here. A couple things to think about are who on your team that you're working with Parkinson's is able to have this conversation about these different types of care, because not everybody is adept at understanding the differences between palliative and hospice care. And it's good to know who your allies are early on. Just, you can just say, what do you know? What do you think about palliative care? What do you think about hospice care? When would that be appropriate? And just get a feel for, is it the nurse practitioner on the team? Is it, who would help you facilitate that? But also, one thing that hospice and palliative care is not is caregiving. They're not going to be there 24 hours a day to look after your loved one. And I think people believe that. So even as Amy said, this is a support system. The doctors may come to you, the nurses, the spiritual counselor. They're not going to sit with your loved one all the time. So it's not the same as caregiving if you need daily needs met. And also, just my experience has been, I don't know if it's across the board, but with Parkinson's, if you are on hospice, you are still allowed to take your Cinemet. You're still allowed to take your medications and treat your Parkinson's, because it's not curative, but it is comfort focused. So you don't have to retreat from all care for your diagnosis. in order to get hospice. And hospice doesn't always mean that, it's only 6 months, and it can, be in place and then something may shift and you get better and you retreat from the hospice, go back to something else. And it can be, again, in home or in a facility. So depending on what your capacity is in the home and the comfort and feelings around wanting to, where you would want that taken care of, those can be addressed individually.
Yes, I wanted to mention 2 resources we have on palliative care at the Parkinsons Foundation. First, we've got an expert briefing with Dr. Janice Miyazaki talking about advanced PD and palliative care in the 21st century. So really understanding what palliative care looks like today. You can find that in all of our previously recorded expert briefings at parkinson.org/EB for expert briefings. And the other one is an episode of our podcast, Substantial Matters, where we have Dr. Benzie Kluger, who's at the University of Rochester, talking about palliative care as a way to ease the burden of symptoms of the disease, including physical, emotional, or spiritual, and that it really can extend beyond the person with the disease to the caregiver. So to listen to our podcast, you can go to parkinson.org/podcast. Just wanted to put those on your radar if you're not so familiar with palliative care in Parkinson's and wanted to learn a little bit more. Our next question comes from Shelley in Virginia. She asks, how do I find an expert social worker specializing in Parkinson's in my mother's community? I need help finding a motorized scooter for mobility, financial hardship, to obtain one that's portable. Kara, do you want to talk a little bit about the use of social workers in our many contexts?
Yeah, sure. I find this question I found rather challenging because I think this is such a regional question, depending on where you live in the country and what is available. And these are things I could answer for my county, but I don't know about Virginia. So I think some of the earlier things that were mentioned, maybe when we were first opening this conversation about, maybe like the elder locator or something like that, your city council on aging, to first reach out to aging resources if you're in a smaller place and not a city where you go to a center of excellence. But if you're near a center of excellence or you have a specialty movement disorder person available to you, then that you could actually reach out. I would say I'd refer to Parkinsons Foundation, go to the website, look at the resources there and see what's available. And my hope for this time of real struggle with this virus is that we now know that we can access people through this camera situation and that we will continue to do this for people all over the world and the nation. And we will learn that this is not just an emergency way of facilitating care, but an extremely important way to connect people to the best resources possible. So I would say reach out to the closest center of excellence and see what they know in your state and see what you can access there. There are independent living centers for people with disabilities. There are services where people recycle certain kinds of medical devices that that people just move them around as they no longer need them. And sometimes there's funding for these types of emergency needs.
Yeah, and I just wanted to add, not enough people know about and utilize 211. So 211 is this incredible comprehensive source of locally curated social services information. It covers all of the United States and some of Canada. So from your local phone, you can just dial 211, similar to calling 911, but not in an emergency. And it's staffed by counselors who can do short-term crisis counseling. They often are the same folks who answer the suicide hotline. But they also have this incredible database of resources that they can search by keyword or by zip code, and they can tell you exactly what's available, what the requirements are, who you need to talk to, what you need to ask. I spent a couple years answering 211 before coming to the Parkinsons Foundation, and it truly is an incredible resource that most people don't think about. I remember that 90% of the calls that we got were people asking for utilities assistance or rent assistance, and that's a big thing that we offered, but there's so much more that people weren't tapping into. So when you're looking for, resources in your community, this is a place to call, because if they don't have an answer, they'll know who the next person to call is so that you can get that answer. And the other thing I wanted to flag for this is, again, if you're a veteran, there's a whole other host of resources available to you through the VA. And the Veterans Administration offers a caregiver service. It's a call center that's staffed by licensed social workers who can explain available services, give you contact information for accessing those services, and provide emotional support. So if you or your loved one are a veteran, you can call 1-855-260-3274 to access the Veterans Administration caregiver service. And then the other piece that I would just be remiss if I forgot to mention is, of course, the Parkinsons Foundation helpline. So if you want to talk to someone who's an expert in Parkinson's who can help direct you to different resources available in your community, you can call 1-800-4PD-INFO, or you can email helpline@parkinson.org. I mentioned sometimes an email is a little less intimidating than making a phone call saying these things out loud. And then you have a paper trail if you can't remember what they told you and they email you back. So they can help you find what you're looking for. And they can also help by looking to see if there are any social workers near you who have completed the Allied Team Training for Parkinson's, which is this extensive program that we offer training healthcare clinicians throughout the country. So that's the other thing I would add. Let me see, we've gone through a lot of the key questions that I wanted to ask. I had one more that jumped out at me that I think, Kara, you'll be able to weigh in on. So we got a question from Ellen in Pennsylvania. She said, my mother resides in a skilled care room of a retirement community. Unfortunately, this facility does not have a good knowledge base in Parkinson's. I've been trying to get them to give her medication on time, not 1 hour before or after the anointed time, but it's been really difficult. And they just aren't quite getting it. They don't provide a physical therapist unless I get a prescription for it. What programs exist for staff education? What can I do to help make sure my mom is getting the best care where she is?
Well, that sounds like you have a lot of knowledge yourself, this person who wrote this question about your mom's needs and what's necessary for Parkinson's. And I think, again, I think it all comes back to the Parkinsons Foundation. I mean, there are so many resources. I would reach out to the helpline. I would suggest reaching out to maybe order some of the books that they offer to educate people, maybe use the Aware and Care pouch to just explain how important this is. I think it's important on a couple levels to just acknowledge that we live in a country, in a culture that that loves to be helpful but doesn't like to be helped, and that it's somehow seen as a weakness. And then we do not provide care providers with enough money or resources, and they're often overworked. And so, it's really tough to go into a setting and say, look, she needs this every time on time, because it's really tough to get that kind of commitment. And it might even sometimes, if you can afford it, be worth it to hire a caregiver to come in and manage those med times. I don't want to be a downer about that, but I think it's a lot that we ask of our providers in these settings, particularly as we are in this pandemic right now. Being on time just to get into your job is hard enough, and then being on time for all the needs of these individuals in a setting. But I think that the Parkinsons Foundation has a lot of resources, and you, I guess Annie could answer this best, is, are there people who could come out and do a training in the setting, or would the caregiver providers in the setting have to go to an ATTP training?
So the answer is mixed. So the best way to train a whole group is through the Ally Team training for Parkinson's. However, we also have really great additional resources available. We've got an online nurse training that is totally free unless you want continuing education. And it talks about a lot of these things. We have Aware and Care ambassadors who are volunteers who are trained in the importance of getting medications on time every time and talking to their communities, including community professionals, about how important this is. And so if there's an Aware and Care ambassador near you, they may be able to come out. And if there isn't one near you, or if there isn't a Parkinson's Foundation staff member who can come out and talk, we're getting pretty good at these video calls. So maybe we can facilitate something that's not in person, but that's live and engaging, like what we're doing today. So this is a tough one, but the reality is, Ellen, you're doing a great job. You are advocating for your loved one. You are educating on their behalf. Keep at it. And the other tool I would add to your toolbox that Kara didn't mention is the long-term care Ombudsman program. It's administered by the Administration on Aging. If you really do feel like they're not getting the care that they need, these are advocates for residents of nursing homes, care homes, assisted living facilities, and similar adult care centers. So they're responsible for helping everyone get on the same page about what care looks like and advocating for changes to improve residents' quality of life and care. So this is a resource that's available. There's not a cost associated with it. You give them a call and they can come out and hopefully help. So I don't know if there's anything, Amy, that you wanted to add around different resources available in that situation.
Well, the one thing I would point out is that in my experience, I've had numerous family members who are kind of in situations like that over the years and worked professionally in these settings myself as well. And one thing that people listen to is the doctor in charge. So the facility tends to have a doctor who's the head medical director at the facility. If your loved one's doctor, Parkinson's doctor, talks to that doctor and says, hey, this is important, and that doctor then talks to the staff and makes sure, says, hey, this is an order. These things have to happen. Sometimes that's one way to get things done. And it doesn't have to be, a negative interaction. It's just a matter of, hey, I want you to know that this is really important and this is prescribed this way. This is the way it needs to happen. That communication is really, really key. So that might be an approach that will work as well. And the other thing is to also be sure to take advantage of the other professionals in the setting. So you may have a physical therapist, an occupational therapist, people who are more versed on Parkinson's disease and what to expect and how to treat it. A music therapist might be coming in. And so be sure to talk with them about your loved one's diagnosis and their special needs. And, I think Kara said it so well, people are trying to do the best they can, often, short-staffed, even if they're making the state minimums. And often, they really do respect and respond to, communicating with them. But, just exactly what she's doing, being an ever-present person with your loved one when they're in a facility is just so important, and that role as an advocate, as a caregiver, is really probably the most important thing that we do.
And just since you touched on that, Amy, this idea of starting with appreciation when you communicate with people. I know you have a hard job. I see how hard you work. I'm so aware of all that you're doing here in a really difficult environment. And maybe starting with some praise and appreciation, and then saying, one of the difficulties with this diagnosis, I don't know if you know a lot about Parkinson's, is, and if you're curious, there's more information. But starting with the appreciation, we forget that sometimes. I think Amy said it so well. We're so used, our brains are built for negativity bias. We are built to notice what's not working. And everything else can be going great, and this one thing is off. And we really need to focus on the stuff that is working so that we can be fair and reasonable with the people helping our loved ones.
Yeah, absolutely. Well, we're coming close to our time to wrap up on this panel. I wanted to just check in and see if there were any resources or words of wisdom that you think we missed that you want to make sure you emphasize for our viewers. Amy, does anything come to mind?
Sure. Well, I want to be sure and share the AARP resources that are available for family caregivers. We have a wonderful website, aarp.org/caregiving, and there you'll find things about caregiver work-life balance and managing finances and managing caring at home and all the caregiving basics, all of those things, legal issues. We have a lot of really great articles and videos and tools and all kinds of great resources for you there, as well as a free publication called Prepare to Care. And you can find that publication there as well and order a copy of that or download a copy. And we have the Community Resource Finder that you can connect with local services. There's just numerous things that are available there, but please reach out. We also have a Facebook caregiving group that we'd love for you to join. I moderate the group, and we have a lot of members who's caring for loved ones who have Parkinson's disease. So it's just another great place because we learn the most from each other. And that might be in your local support group. It might be in an online group, doing webinars like this. So share what you're learning as well as learn from others. You may think, oh, I don't know anything, but you do. You've got wisdom and experience that you can really help others, and know that, waves are going to come along and knock you down. I always tell caregivers, I finally realized this myself in my own caregiving experience, that things like, especially times like now when maybe your loved one's in a facility and you can't see them, or you're stuck at home and don't have any care coming in, or someone gets sick and is in the hospital. There are all kinds of crises that come along. And you get the waves come along and they knock us down. But that's not failure. You get back up and you're resilient and you keep going. The one thing you know you can do is be there and do your best. You're looking for answers, you're educating, you're advocating. It's not all going to be perfect, but you can do this, and you can be successful as a caregiver by just being there, being resilient, and loving and caring for your loved ones.
How about you, Kara? Anything you want to make sure we emphasize before we wrap up?
Well, I think that, again, as a mental health provider, I like to talk a lot about how we think and what we believe and where we come from. And there are so many cultural dynamics that we take on as if we made them up, and somehow we're super critical of ourselves and there's something wrong with us. I mean, we come from a really strict history of bootstraps and do it yourself, and you shouldn't need anybody. But the reality is we're all interdependent. And I like to tell people, I'll bet you didn't weave all your clothing or harvest your own food that you ate today. So we'd be naked and hungry if we weren't depending on invisible webs of support that are already out there supporting us. And that it is human to need each other, and we are social animals. And I think some of us are really learning this through this virus crisis, and we have to be creative problem solvers. And sometimes when we do it by ourselves in our head, we ruminate, and we need to just go and share thoughts, share ideas with other people. And it makes me think, one time I run 2 support groups for people, women married to men with Parkinson's, and the other one's a little more inclusive, but it just so happens it's usually women. And one of the women just said, I was so beating up on myself, and then I just reminded myself, just be tender. And everybody just sighed when they heard that. Like, what an invitation. You're doing a really hard job. Your whole relationship is changing with this person who has Parkinson's by the nature of the progress of the disease. Why beat yourself up? Surround yourself with people who understand what you're going through. And there are so many ways to solve problems, and you don't have to figure it out by yourself. And being loving and kind and compassionate with yourself is as important as it is for you to be with the person who's living with the diagnosis.
Yeah, absolutely. I always like to remind people the importance of asking for help before you're drowning. This disease is a marathon. You're going to be caring for your loved one for quite a long time. People live well with Parkinson's for 20, 30 years. And it gets a little more challenging as time goes by. It gets more and more falls onto you as the care partner. So take an inventory today of where you are and what you could do to ask for help today. Think about laying the foundation for asking for help, whether it's, the loved ones who are near to you, whether it's looking to professional services that can come in. Really just think about making a habit of asking for help. Even if you don't feel like you desperately need it, ask now. So I want to thank both of you, Amy and Kara, for all of your insights on this topic. I think this was a really great discussion, and I want to thank those of you who sent in questions. We got some really great ones for all 4 of the panels today. Of course, we didn't get to address all of the ones we wanted to, but this is the conclusion of our 2020 Care Partner Summit. I hope that you have really enjoyed it. I hope you've learned something, and I hope you're walking away with new tools in your toolbox. Before we wrap up, I want to make sure that I thank our sponsors, Acadia and Neurocrine Biosciences. We couldn't do this without them. I want to thank all of the speakers. I want to thank all of you who have joined us to make this such a special day. And again, I really hope that you're able to apply some new tools into your life living with your loved one with Parkinson's. And I hope that we will see you again soon, hopefully in person next time. Thanks so much.